today is talk about the theme of the conference, but I've changed it slightly to global health research, innovation and nursing. So just to, I've been introduced, but within the context of the theme, which is about global health, I think we learned about what is global health or global health से हमारा मकसद क्या है, but if I try and kind of put that into practical aspects, I think I can do so very much थोड़ा उसकी जो example दे सकती हूँ by giving examples of my own role. So I work as a professor of gender-based violence and professor of nursing at the University of Sheffield. Professor of nursing because nursing is my discipline and I work around research capacity building. Professor of gender-based violence because that's my research area. That's where I talk a lot. And the third role which I have, I'm editor-in-chief of International Nursing Review, so which gives you quite different role at 3 different places. And all of these roles are important and focused on research capacity building among nurses, midwives, and allied health professionals. In terms of my research, I look at 3 different areas, which is gender-based violence or domestic abuse, consanguinity, जिसको अगर आसान लफ्ज़ों में बोला जाए तो cousin marriages and genetic risk associated with it, and how can we make healthcare professionals more approachable to people and increase awareness among populations. And how can we develop healthcare professionals' preparation around providing care to individuals so that inequalities in healthcare are better catered for. Okay, so this tells you the breadth and depth of what nurses can do these days. So the role is just not limited to the hospital only. That's how once we used to think about. It's very global and it's very multi-professionals where we work with colleagues all around the world. When it comes to one of the things that we need to work on when we want to decrease the global health inequalities is to increase research and to be involved in research. But if I ask you, how many of would you say that you are involved in research? शायद कोई भी नहीं बोलेगा. How many of you would say that you contribute to research activities? करता है कोई? सामने वाली रो बैठी है बिल्कुल करती है. How many of you publish research? ठीक है, and there are quite a lot of us at the back seats who are going to be doing it. When did research and other aspects started? So we talked about Florence Nightingale or Florence Nightingale ka impact on environmental health and everything else that we talked about. But did you know that she was the first statistician and she is recognized as such? Okay, so she was the first one who presented this kind of chart which basically looks like a pie chart. आजकल के ज़माने में जो pie chart हम देखते हैं उसी तरह का है, but it's slightly different because it also gives proportion of the situation. So what happened when she went to the Caribbean ward, वहाँ पे जो soldiers हैं वो बहुत ज़्यादा मर रहे थे और एक assumption ये थी कि जंग है, लड़ेंगे तो मरेंगे तो सही, ठीक है. But what she looked at, that soldiers were not dying because of the wounds that they had, but they were dying because of the poor sanitary conditions, not having the wounds properly managed and not having appropriate diet. तो उसने वो डेटा चार्ट करना शुरू किया सारा, और उस चार्ट की मदद से she was able to explain कि जो डेथ हैं उसके कुछ preventable causes भी हैं और जिनको हम ख़त्म करके, जिनके साथ हम डील करके हम चीज़ें ठीक कर सकते हैं. So she was the first statistician and she is recognized as such by Statistical Association in London, which was the first one for her role. When it comes to research development statistics, ये वाला चार्ट आपको ये बताता है कि ह्यूमन एंड फाइनेंशियल रिसोर्सेज रिसर्च एंड डेवलपमेंट में किस किस कंट्री ने कितनी इन्वेस्ट किया और फिर हम उसका रिजल्ट देखेंगे. तो जहाँ पे जितना बड़ा सर्कल है वो उस कंट्री ने उतना ज़्यादा उसमें पैसा इन्वेस्ट किया. तो आप देख सकते हैं चाइना, फिर यूएसए उस तरफ काफ़ी ज़्यादा है. तो वही आप उसका एविडेंस देन पब्लिकेशंस में और जो रिसर्च के आउटपुट्स हैं उसमें भी देखते हैं. So as you can see on this chart, China is the top one. So this data is from 2018, but 2023 में भी कुछ नहीं बदला है. So China is the leading country who is leading in research and publications. Then comes USA and then comes India. और फिर उसके बाद के आप सारे देख सकते हैं. Okay. This also gives you some information about number of funded publications and number of publications which have happened और मुख्तलिफ किस तरह से बढ़ता चला गया है. जैसे जैसे नर्सिंग रिसर्च के अंदर फंडिंग इंक्रीज हुई है, people have started developing and writing more grants, writing more bids, putting more publications in, so which tells you that there is a relationship between how much funding or investment is being done to the outputs that we produce. And that just gives you the geographic distribution of the countries of global nursing research के जहाँ कहाँ किस तरह से हो रहा है. So and this chart basically tell you the top 20 prolific countries के जहाँ से सबसे ज़्यादा publications आती हैं. पाकिस्तान का नाम दिख रहा है कहीं? ठीक है? But we can aspire to be here. And these are the top 5 countries in the top 5 active journals when we talk about nursing research. Okay? So, why we are talking about this? Because if we want to develop our frontline practitioners and if we want to be working effectively, we need to be able to demonstrate our involvement in research, and we need to be able to provide that evidence through publications too. Okay? There are different barriers which happens which doesn't let us do that, and these are not related to any particular country, but what I've seen is internationally. So for example, individually people lack research skills, or there are issues with confidence and competence कि जहाँ पे उनको लगता है कि जी हम नहीं कर सकते या हमें करनी नहीं आती, which is not true by the way. Personal career related issues, क्या आप ज़िंदगी की कौन सी स्टेज पे हैं, what is it that you need to focus on, that could have an effect. Problem securing funding, because research funding के बगैर नहीं कर सकते, so where do you get the funding from? How do you write for those funding applications? How do you make sure that you're able to get it? And tension splitting clinical and research time. There is always this tension when it comes to medical and health research, that clinicians का role आपका जो है क्लिनिकल और उसके नॉन क्लिनिकल जो रिसर्च एक्टिविटीज़ हैं उसको आप किस तरह से डिवाइड करें. दैट हैज़ ऑलवेज बीन अ प्रॉब्लम एवरीवेयर, बी इट्स नर्सेज, मेडिक्स, अदर हेल्थ केयर प्रोफेशनल्स और anybody else. Then there are organizational challenges which includes lack of clear entry points कि कहाँ से आप research career start कर सकते हैं, lack of clear role models, organizational support in terms of progressing those values placed on research, and then of course there are funding related issues which have got various things, like for example non-inclusive languages. हम अगर यूनिवर्सिटीज़ में भी देखें तो कितनी दफ़ा जो research conferences अगर health से related होती हैं, how many times do we see nurses involved into it? I think it's getting better, but we need to be doing more around that. And that is because people don't know if nurses can be involved or are involved in research. So, what do nurses already do? Nurses research करती हैं कि नहीं करती? ठीक है, पूरी दुनिया में मैं जहाँ पर भी जाती हूँ, and one of the things which you ask, when you ask nurses, do you research? And usually, I'm talking about those who are working students, those who are working at the ground levels, frontline practitioners, and when you ask them, they usually are not able to answer that question. But that's not true. It's not true that nurses don't research. कैसे? आप सब कंट्रीब्यूट करते हो रिसर्च में बाय रूटीन कलेक्शन ऑफ डेटा. ऐसा है? जो डेटा आप कलेक्ट करते हो, does that become part of research? Does that tell us anything about what's happening in any healthcare system? Patient surveys, सैंपल्स जो कलेक्ट किए जाते हैं, ब्लड सैंपल्स, कोई भी सैंपल्स दूसरे कौन करता है वो? ठीक है, मेडिकेशंस रिलेटेड डेटा जो आता है वो कौन करता है? आइडेंटिफिकेशन एंड रिक्रूटमेंट ऑफ पार्टिसिपेंट्स इन रिसर्च स्टडीज दैट यूजुअली हैपन्स फ्रॉम मैनी हॉस्पिटल्स के अंदर से, वार्ड्स में से होता है, बहुत से यूनिट्स में से होता है, दैट इज डन बाय नर्सेज. इम्प्लीमेंटेशन ऑफ ट्रायल्स एंड इंटरवेंशंस, तो जो भी आपका रिजल्ट्स आते हैं किसी स्टडी के, व्हेन दे आर इम्प्लीमेंटेड, हु एक्सप्लेन्स दोज थिंग्स to patients and how does that get implemented? Now depending on the geography and the roles that you perform and how you communicate, this could be slightly different, but I'm giving you an overall picture. So we do quite a lot of things already, but we don't necessarily always recognize it. Okay, what's the solution? What is it which we can do? What we can do is that we can increase awareness about research and how we contribute to it. Okay, first of all, knowing ourselves as to how do we do it, knowing what do we do it, understanding that would help us then help others understand as to what is it that we do and what can we do better. We can include research and evidence practice in undergraduate nursing education, and I think this is what we are trying to do today. That undergraduate and postgrad nursing education, if you start at that level, if you start understanding from the basic principles of it, then you get involved into research and then you take that forward as you move along. Provide research placements to undergraduate nursing students. So all those senior colleagues who are sitting here, involved in research up here as well, I would suggest please, as you include or as you develop research placements for the undergraduate students, regardless of their discipline, we should be doing this for the nursing students as well, so that we expose them to research and expose other students and other disciplines that nurses भी research करती हैं. क्योंकि हमारा आधे से ज़्यादा मसला तो ये है ना कि हमें पता ही नहीं कि दूसरा प्रोफेशन क्या करता है. ठीक है ना? Ensure nurses are provided with time, space and money to be involved in research endeavors. 60% of the healthcare population, 60% of the healthcare service providers are nurses. Okay, 70% of the healthcare workforce all around the world is women, and 60% of the healthcare workforce is mainly nurses. So it's a very, very big component. उसका एक मसला ये भी होता है कि जो काम कोई नहीं करता वो नर्सेस करती हैं. So therefore there is always a shortage, therefore there is always issues. तो टाइम और रिसर्च के लिए निकालना और उनको उस चीज़ के लिए अलग से टाइम प्रोवाइड करना is always difficult, but we need to find ways of doing that. Okay, so एक जो चीज़ और बहुत important है, and the message which I would like to give you, I was told I only have about 10 minutes, is that right? So I'm going to finish soon. But one of the things which I learned is that when we talk about nursing or any particular discipline, medicine, allied health, any that you talk about, we need to think as to who would be interested in it and why. ठीक है? नर्सिंग में सिर्फ नर्सिंग्स को इंटरेस्ट होगा. Would you believe that? अगर आपने दुनिया को ये बताना है कि नर्सिंग इतनी इंपॉर्टेंट है, नर्सें इतनी अच्छी हैं, तो किसी को नहीं पड़ी हुई, सिर्फ नर्सें ही सुनेंगी, नर्सें ही समझेंगी. ठीक है? तो अगर हम बोलेंगे कि जी नर्सिंग रिसर्च करनी है, तो एक तो पहले तो नर्सिंग रिसर्च होती क्या है, मुझे तो ये कभी समझ नहीं आता. बिकॉज रिसर्च इज रिसर्च, आप सारे हेल्थ केयर प्रोफेशनल्स उसी पे करते हैं. But then when you talk about this, you need to talk to people so that they understand what you're talking about. Okay, so no one else is interested in nurses, but everyone cares about patient safety. ठीक है? हर किसी को चाहिए ना कि उनका पेशेंट, उनका वालिद, उनके बच्चे अगर हॉस्पिटल में जाएं तो दे आर केयर्ड फॉर प्रॉपरली. हर किसी को चाहिए कि पॉपुलेशन हेल्थ बेहतर हो. हर किसी को चाहिए कि हमारे डिजीज़ और जो है बीमारियां नहीं फैलें किसी भी तरीके से. ठीक है? And when we talk about those things, everybody would be interested. Everyone would want to know economic aspects of care. Every government and every organization wants to understand how can we reduce the cost, but how can we provide better services. Is that true? है कि नहीं है? ठीक है? Timeliness of care and service provision. Everyone is interested to get services which are available at the time when they need and for which they don't have to wait for. And prevention of disease and promotion of health is in SDGs, it's in the Global Health Agenda, and everyone is interested in it. So if we want to be involved in those aspects, if we want to be to develop and have our role acknowledged, we need to talk that language. Okay? Instead of कि उसमें हम उस तरह से बात करते हैं, if we explain why is it important to have involvement of 60% of the healthcare workforce in research and development is for these reasons, will somebody be able to ignore you? Okay? And then there is importance of collaboration and importance of networking. So this is a network analysis taken from one study which tells you how people have collaborated within the field across the world in different places to be able to get more funding and to be able to better publications. So you don't only work within your profession, but within the discipline which is health and outside discipline. ठीक है? पहले ऐसा होता था कि डॉक्टर्स, नर्सेज, हेल्थ वाले सिर्फ हेल्थ में काम करते थे, इंजीनियर सिर्फ इंजीनियरिंग में करते थे, दूसरे लोग सिर्फ उधर करते थे. बट व्हाट वर्ल्ड हैज रियलाइज्ड that the solution to world's problem is interdisciplinary research. No one discipline or no one place is able to solve the issues that we are having. ठीक है? अगर हम फॉर एग्जाम्पल waterborne diseases की बात कर लें, तो अगर हम सिर्फ हेल्थ केयर प्रोफेशनल्स पे फोकस करें, is that going to solve the problem? We need to work with environmentalists, we need to work with people who are involved in that kind of science to be able to understand that. They need us to understand the mechanism, they need pathologists, they need microbiologists, they need other people who can explain that side of the work, and they need other people who can help them what would help and how, which functions would work. So that's something which is very important. And this again is another graph which again shows you the importance of networking collaborations, that when you network and collaborate, you not only learn by what's been developed or what's been used in other places, but you also learn what's been effective in other places. और कौन सा काम है जो दूसरे लोगों ने किया है और नहीं हुआ, इसलिए शायद हमें उसको मॉडिफाई करना चाहिए या नहीं करना चाहिए, या ऐसी कौन सी चीज़ है कि जो हम किसी जगह से अडॉप्ट कर सकते हैं, या ऐसी कौन सी चीज़ है जो हम खुद कर सकते हैं. ठीक है? Okay, I think my 10 minutes are over. Thank you so much for listening, and it's always beautiful कि आप पाकिस्तान में बात करने की सबसे अच्छी चीज़ ये होती है कि आप अपनी ज़बानें स्विच कर सकते हैं और उर्दू में, सिंधी में, पंजाबी में जिसमें बात करें वो बात कर सकते हैं, और उससे ज़्यादा अच्छी कोई चीज़ है नहीं, क्योंकि आपको भी अच्छा लगता है और लोगों को भी समझ आती है. थैंक यू फॉर लिसनिंग.